Alright, so we were talking about electroconvulsive therapy, and some of the problems with that is the relapse time and the placebo effect that it could possibly have. Here's a little more showing what it looks like. So they have the stimulated electrodes up here on the forehead. They have the ground. They have the ECT device, the recording EEG, the recording ECG, which both of those are uh, one's basically keeping track of what's happening in the brain, the other one's keeping track of what's happening in the heart. Blood pressure, the EMG, which records electrical activity from the muscles, what are the muscles doing as electrical response, and then the muscle relaxant or sedative goes in through the IV. There's also a thing called magnetic stimulation, or rTMS, which is repetitive transcranial magnetic stimulation. One of the things this does is just magnetic impulse. It's a lot less intrusive than the electroconvulsive therapy, ECT. It's just using magnets. So one of the things it does is it can help uh, fight depression. It basically uses a magnetic pulse to stimulate brain cells. It focuses on the limbic structures here in the brain. You can see right there that most of them are used to control emotions. It helps keep the neurons more active, which can increase mood, help mood, whatever. There's also deep brain stimulation. This is basically the neural hub between the frontal lobes and the limbic system. That area, they're stimulating that part of the brain with magnets, and then being able to basically from that, uh, being able to help ease depression or other mood disorders. Here's a little closer look at where the magnetic fields would be, where the wire coil is. One of the things here kind of shows you what the depth really is. Also, now we have psychosurgery. One of the things, this is really an interesting topic on lobotomy. Lobotomy is something that's been used for a long time in earlier medicine, but as recent as the 60s. One thing that we look with psychosurgery, we have that split brain that we talked about in biology. So it has been used with some seizure patients. It's not that psychosurgery is never used. One of the things with lobotomy is basically cutting the nerves between the frontal lobe and the limbic system to the emotional controlling center of the brain, which could involve the amygdala and other brain parts. Now, one of the things that we have as a history, in the 1930s it was used, but it was also used in the 60s. The procedure was to go through the eyelids, just as the picture showed you before, go through and cut that between the frontal lobe and the emotion centers. One of the problems is that lobotomy was used between the 30s, 40s, 50s, but it had some side effects. One of the big name, I guess you could say, would be JFK's, which the president, his sister, her name was Rosemary, good Catholic name. She was lobotomized. I was thinking she was like late teens or early 20s. I can't remember the exact age, but she had some severe uh, mental problems and had struggled with them. But one of the problems with that is when she was lobotomized, she was basically reversed to a mental age of what they call like infant. So she was not able to function as um, a regular person anymore. She was not able to care for herself or use the restroom or things like that. Um, One of the most interesting things about Rosemary is she lived till she was 80 years old. So that's one of the failures showing there. And it's actually JFK um, showing one of the pictures of him with his sister Rosemary. One of the things that we also look at is a therapeutic lifestyle change. This is where the wilderness camps, the the therapy sessions that involved outdoors, or some of the teen things, the boys ranches, those kind of tend to follow this therapeutic lifestyle change. So many times we have to look at the fact that it's not just bio, it's not just psycho, it's also the social aspect of that, and many times it can really help overall with lifestyle change. So, aerobic exercises showing that increases not only fitness and vitality, but also increases endorphins, which can help things like depression. Giving adequate sleep. So, one of the things that they find is that um, people getting enough sleep, or the sleep that they should get, 7 or 8 hours of sleep, especially maybe when they're in a controlled environment like a wilderness camp, can help teens or adolescents that might previously get very few hours of sleep. Showing more light exposure, that vitamin D, many times, it sometimes is used, even light boxes or vitamin D lamps are used to increase it, not just be it outside. No social connections, showing that having less alone time and more social engagements, whether they were friends or just other people in the group walking kind of the same road, can really help. Um, I think the other thing is keeping in mind that rumination, that repeating the same thing over and over. Sometimes with OCD and other things, other abnormal behaviors, many times therapeutic lifestyle changes can really help with that. We're tending to change one's scenery or change in their environment can help with decreasing those negative self-talks. And then nutritional supplements. Many times these are focused on omega-3s, things that are found in fish and other oils that have actually found to help things like depression. If we look at biomedical therapies, you can see the drug therapies. This is looking at neurotransmission malfunction. It's controlling many of the psychological disorders. Its technique is to alter the brain chemistry through drugs. This is like the excess serotonin that's there when it's within the synaptic gap, not being able to be reuptake into the neuron because of the Prozac, which is the antagonist. We have the brain stimulation, which is the treatment-resistant depression. Uh, it's hopefully to alleviate depression that's unresponsive to other drug therapies. This is the ETC. This is uh, magnetic pulses or deep brain stimulation. Psychosurgery. This is very very tactfully used. It's not used a whole lot, but it's when the brain is malfunctioned and it's used to remove or destroy brain tissue. We don't normally like to do that. There are cases where they still have psychosurgery, just not very many. Therapeutic lifestyle change, the idea is the stress or whatever the unhealthy environment around that psychosocial individual. If maybe we can change the social part, we can work on the psycho and the bio at a later state, hopefully return it to a healthier biological state also. The end. I apologize for my stopped up nose and everything, but I promise you it's better than me showing up tomorrow and giving you all my fever. Have a great day.